Who? Can you hear me okay?
Yes.
It's funny because I can't hear me at all, but whatever.
All right.
As long as you guys can, I guess it's okay. I turn on the mic. Oh, there I am somewhere.
All right.
David, how are you, David? Be honest.
I am very good. How about yourself?
Good. You have a pleasant
yes,
turkey
indeed.
day and all that. Did you eat lots of it?
I ate lots of food. I don't eat turkey, though.
Why?
Why? I don't know.
It's a sort of a personal question, but we always ask personal questions here on the Saturday
I'm
special.
good for that. I'm good for that. No, I'm a pescatarian, so I eat fish and seafood.
Fresh fish?
Fresh fish when possible.
Uh-huh.
But, yeah, we went for the rubber chicken field roast for my option. But the rest of the family, they had their turkey. So we did our part for the turkey industry.
We had the breast in bed. I mean, the best in...
Oh, my.
I'm trying... Yeah, never mind. We
A good time was had by
We had
all.
the best fresh fish ever yesterday.
Ooh.
I found some fabulous pieces of Chilean sea bass.
Nice.
On Wednesday. I couldn't help myself. I bought them.
All right.
I didn't know how to prepare them.
I'm going to have to know where you got those from.
Oh, yeah. I don't even know the... Lions Market. Lions Asian Market in Milpitas, California.
I'm definitely going to put that on my map.
Oh, my God. Yeah, it was really, really, really good, especially the way it was. Some people say that fresh fish is good enough to eat raw, like sushi. But I haven't done that. I haven't had the nerve to do that yet. Maybe someday.
Yes.
All right. Well, it's nice to see your smiling face, and you made it past the bulk of the holiday.
Same here.
Okay.
Over the hump.
Now, another Dave. Dave Michaels.
Good morning, MZ.
How was your holiday?
It was great. It was fantastic. It was
You're
nice
wearing
and relaxed.
something like something that resembles
a 49er Christmas hat.
Yeah.
Yes, along with my Let's Go Brandon
Let's
sweatshirt.
go,
Yeah, I'm ready to go, man. I am in the Christmas spirit. How was your Thanksgiving, MZ?
It was damn good.
Good.
It was really there was lots and lots of turkey.
Good.
Roast turkey with all the
I know sometimes it is the holidays, MZ, and sometimes, we eat maybe too much and maybe even things that we shouldn't eat. That does happen. So
that's why I'm probably going to have to leave.
Might I suggest the Ultimate Rainforest or the Flora FX and the enzymes? That's part of the Healthy Start Pack. Now, down at the Dave Cave, we're waiting for our next shipment, but right now we have everything except for the Osteo FX. So that would include the Digestion Pack, the Root Beer Belly, Arthrodex for your four-legged friend, as well as the Herbal Rainforest. That's another product that we have. It's a nice, gentle way to get your system moving. It's not a laxative. It's not going to make you run for the restroom. It's going to make things move through nice and slowly. And the Root Beer Belly is one of my favorites because that helps food digest right as soon as you've eaten it. You don't have to wait for, a half hour or anything like that. As soon as you take that, it's fantastic. Starts working within just a few minutes. It's really good stuff, MZ. The Flora FX is, if you want to think about it, this is your gut health, right? So enzymes will help you to digest the food, help you break it down, and the Flora is the good gut bacteria. That's what's going to help once it exits, right? So enzymes...
Sounds delicious.
I fell off my bike, MZ, and it hurts to laugh. So,
yeah. I'm sorry about that.
But we've got a whole bunch of good stuff down there. The only thing that we don't have is the Osteo FX. But everything else we have, it's a good time to stop by, pick up a great deal, because the sale, I don't know if we're going to have our shipment in time for the sale next week, but you can stop by right now and stock up on what we do have.
Because that is on sale. Yeah?
That is on sale, yes.
Okay,
yes.
Cool.
Yeah.
Oh, my God. And you're going to be here until what time today, Dave Michaels?
I'll be here until 2 o'clock. I'm out of here at 2 o'clock. So make sure you get here before 2 o'clock.
You have stuff to do
on
this holiday weekend.
Yes.
All right.
So I'll be out there until 2 o'clock. I would love to see everybody come out there and pick up a great deal. It's perfect time to save some money, MC.
It's a perfect time. It's never not a good time to pick up a great deal.
Right.
Am I correct?
You got that right.
Okay. Well, that being said.
Good morning. A brighter day is here. Good morning, may we bring you cheer.
We've got time, we've got tunes, we've got time, tunes, and temperature.
Get up and go, it's today, on KSCO Radio.
I thought I was clever by turning off my mic before I cleared my throat, but I realized that the other two other mics were on. Do you think people heard me clear my throat?
Hope not.
Okay, I hope not too, because it's a disgusting sound. Welcome to the Saturday special, ladies and gentlemen in KSCO land. We hope you will stay tuned for 2 hours and be happy you did.
Good morning. Now stay right here on KSCO Radio.
Ominous crossfire theme music introduces this edition of the Saturday special. There are some sinister things going on, ladies and gentlemen, out there. We're going to clue you in on it. Amy. Hi, Amy.
Hi, good morning.
How are you feeling today?
Pretty good.
Except,
Survived the Thanksgiving.
yeah. So, except, now, weren't you shocked when you recently learned something about your personal health care?
Yeah. It's regarding, I think, probably affect to lots of people have a Medicare. You know, we just saw, I think it started a couple of months ago, they were highly advertised some advantage Medicare supplement plan or everywhere.
Everywhere.
Yeah, every channel, you know. So I think I'm okay because I have a Medicare, also have a supplement from United Healthcare, and for years provided by the AARP. So I choose the highest one, an F, which where you can freely choose your doctor, doesn't need a referral, right? But I didn't know 2 weeks ago, my internal medicine doctor, which was they call a primary care doctor, was ready to retire. And he told me, and he wait for 3 years, nobody want to take over his practice.
Does that have anything to do with COVID?
No, it's nothing. It's before COVID, he already looking for somebody by his practice.
Right.
But I think a lot to do with Medicare and the government cut down the cost.
Yeah.
So especially for the internal medicine, primary care doctors, so they get not enough money. So it's nobody want to beat that. So it's shortage of the primary care doctor. So I didn't know he's going to retire very soon, end of this year. Because he said, I can't wait anymore. I'm over 70.
Right.
I want to retire.
You're probably sad you like this doctor a lot, right?
Yeah, also he practiced some 40 years or something. So 30 years or 40 years. And he think normally you can sell your practice because you have lots of patients, but nothing. So he said, doesn't matter. I just don't want to do anymore. Mm-hmm. So that, but you know, I said, okay, it's easy to find a doctor. I didn't even concern that issues. I think it's so easy. I just because their office, their group have so many doctors.
Yeah.
And the same system, Sutter system.
Sutter,
yeah, it's the biggest system, you know. And then I tried to get another doctor, and nobody take me.
Why?
I was shocked because they said. Then I called Sutter. I said, well, is there any doctor? I want to be in the system. I don't want to change into another system. He said, you had to join something, another, it's called the Brown and Thailand, Toland, some physicians group. I said, why I had to join that? You know, I have a Medicare, I have a supplement.
And you have the best plan there is,
yeah,
right?
Also because I like the success in San Francisco because they have a brand new hospital and very nice. Everything, you know, is, very advanced facilities, everything. So I don't want to change it. But nobody take me. So I called the Sutter. I said, why? They said that because they don't have a contract with Medicare. That I was shocked. How come they don't have a contract?
Okay. Hopefully, we have the absolute perfect person to answer that and just about any other question you have when it has to do with health care. And that is our own... Well, here, wait a minute. Here, let me do it the right way. Pamela Fugitt-Hetrick. Of course, Pamela Fugitt-Hetrick. There's nobody better than Pam when it comes to answers about medical and healthcare and all. Welcome back to KSCO. You're here every Thursday night from 7 to 8 p.m. on the Money Moves show. But it's health moves and money.
Well, this time of year, it's a lot about health moves because that's the hot topic during fourth quarter.
Yeah. Now, what's the deal here? They have this window from the end of October to like December 7th or something, and every commercial you see, at least every other commercial you see or hear on radio or television, is to hustle you into joining some Medicare Advantage group so that you can get services that you don't get now. Like, I don't get dental service, I don't get vision service, and when I see all these ads, I think, oh my God, I'm really missing the boat. And then I talk to you and you say,
no. The advantage is not to you. The advantage is to the physician system and to the private insurance companies that manage those plans. It's a complete replacement of Medicare. So it's not Medicare and an Advantage plan. It's goodbye Medicare, I want the Advantage plan.
Well, it sure... I smelled a rat when I realized how much advertising is done. The only advertising that is done, and this is all year round, more than that window from the end of October to the end of the first week in December, is the prescription drugs.
That's where the money's at. Most of the companies that run these Advantage plans are drug companies. That's where the money's at.
So explain to us, please. Well, I don't want to be all over the map here. What should we do? You could answer Amy's concern, right?
Well, I can address the Sutter challenge.
Okay.
They're a challenge. Sutter has been a thorn in my side for a long time, so I elect not to go there because they make my life miserable doing the job I do. But they have beautiful facilities. Everybody loves their doctors, so I cannot say anything negative about that. They're considered the country club hospital here. It's very lovely. I think they even won the clam chowder contest down at the boardwalk, so I guess even their hospital food is good. But they are a more expensive system. Their charges are about 60% higher than other systems that we have here. And so Medicare will say you get X amount of dollars for these services. And if you have plans like Amy, where you have Medicare and a supplement, they only get paid when Amy comes to get a service, right? So if you go and have an office visit or get x-rays or lab work, that's when they get paid. In an Advantage plan, the advantage to them is that you now have told the government, I don't want Medicare from you. I want to have it from this Sutter plan that Sutter has. They came out with it a couple of years ago. It's a very nice plan, and I like the company that they get to manage it. As an agent, they're the nicest one I work with. But the advantage is that the government goes, cool, we're not responsible for all your health care anymore. Okay, so here, Medicare Advantage company, here's $10,000, take care of Amy. So now they get this big old chunk of money up front.
Whether Amy uses it or not.
Whether you use it or not. And so the money that you've been paying into Medicare, they turn around and go, okay, average claims for somebody's about $10,000. Not me, not you maybe, but somebody's out there using that and more. And so they get the money up front. So that's why the advantage is to that doctor system and why they want to be highly, saturated with these plans. Sutter does currently take Medicare with supplements, but only if you're a current doctor or a current patient. So they discriminate. If I was a Sutter patient, like my mother, then she could get stay on her Medicare supplement and life is good, and she goes in and like there's no problem. But if I went in and tried to be a patient there, they would tell me no because I would have Medicare and a supplement. And so I could not use the Sutter system. This is their choice to operate that way. They're in competition with Kaiser, who is only a Medicare Advantage company. And if you want to compete with that, you kind of have to deal with the model that they have. Kaiser does not take Medicare and supplements. They're only their own Medicare Advantage
It's like
plan.
an HMO.
It's an HMO. So people always tell me, oh, I have an HMO, I have a PPO. I'm like, and sometimes that answer is true, but more often they have a supplement, which is neither an HMO or a PPO. It's essentially a pooper scooper. Medicare adjusts all the bills. I have dogs, right? People can relate. There's always things left behind, and the supplement sweeps them up so that you don't have to pay them. They don't make any decisions. There's no list of doctors. That's the beauty of it, is until recently, you could go anywhere you wanted, including Sutter. When Sutter finally got their own Medicare Advantage plan, that's when they started the discrimination practice. And I've had clients who are they're in a Sutter system here, and now they move to Sacramento or wherever, and they're treated exactly like a brand new patient again.
Yeah.
Even though they have been with Sutter their whole lives sometimes, because they've moved to a new area with a new Sutter system. Our PAMP system here and the Sutter system in San Mateo or wherever it is a completely different system. It's pretty
Amy, you've been in
disjointed.
San Francisco for years,
Oh, yeah. For
and you're still in San Francisco.
Yes. Yeah.
And so, what's the problem with Amy being treated as a
I
new-
just want to change in doctor, but then
Right.
because they
'Cause
trade
you
you
have
as
to. Your doctor's going
yeah,
away.
Yeah.
So they trade you as a new patient.
Yeah, that's a
So
sad part.
basically, you're out of the system already, automatically.
And what
your
she said
doctors-
is totally true about doctors do not want to be a they've been reduced to being an administrator. You're an administrative doctor. You push a lot of paper. You press a lot of buttons. And when you went to med school and invested your whole life to be a doctor, that probably wasn't the kind of work you had in mind. You know, you like to treat people. You like to solve their problems. You don't want to be responsible for pushing paper. And when you work for a big system like that, you're forced into seeing 30, 40 patients a day. People are like, oh, I don't want to get a new doctor. It's like, well, if you have one that actually could say your name, like my name's complicated. If I had one that actually pronounced my name right in my entire life, not since I was a kid, because I don't go very often. Go a couple, once every other year just to make my mom happy. So I'm a really low-end user. They're not going to like me because I don't use services, I don't make them money.
Right.
So you're right. Everything had to follow the money. So what's behind the scene? We didn't even pay attention to it.
Right. And so it's not in this particular case, it's not the government doing it. It's not Medicare doing it. It's a private enterprise deciding how they want to run their business.
Well, it's the government doing it in the sense that they are willing to say, here's $10,000
Yeah.
in a lump sum. Is
Well,
that right?
that
Is it
all
10,000?
started back in like the 80s when the HMOs kind of came to being. So we didn't have HMOs until the 70s, 80s.
Yeah, I think Clinton time.
Yeah.
Health maintenance organization.
So when we were starting to move in the direction of, quote, socialized medicine, moving into these managed, I get hackles up anytime you say managed care because I hate to be managed. I'm just ruggedly independent, right? So it offends
sort
me.
of like Amy.
Yeah.
Sort of
I
like me.
remember the
Good. High
HMO.
five.
Sort of like
Amy.
KSCO listeners.
I
That's right.
remember HMO time, they really determine how many days you can live, how many days you stay in the hospital. They have, in the hospital, the social worker is much more than the medical personnel.
Oh, yeah.
Yeah, unbelievable. They will have a meetings, a conference with family, because that time my family members dying. They will say, you only can stay for 6 days. The HMO only pay that much. You had to die in 6 days. Unbelievable, It's called managed health care.
Yeah. And I mean, it's
And
for
it's
some
getting
people,
more managed every day, not less managed, right, Pam?
Yeah. I mean, a lot of it is people they like the simplicity of a managed care. My parents would be an example of somebody, if they went to their doctor and the doctor said, go over here, do this test, whatever, they would obediently go and do those because their respect for doctors is very high. For other people, they're like, no, I want to go to Stanford. I want to go here. I want this alternative care. I want, and we have a shopping list of things that are important to each and every one of us. And so those people are better served by having a supplement. And all the things that you hear on TV, yeah. I mean, this time of year, I do Medicare all day long, 7 days a week. I cannot watch TV right now. I used to be able to watch the Hallmark Channel, and now they even have it. And all those ex-football players, I want to take them out behind a barn. They don't know crap about Medicare, and they're pimping it. So, I can't even watch TV. I've taken up paint by numbers and a few other hobbies to entertain myself at night. So I just can't,
So I worry about is the current status, our insurance, like we have Medicare and the supplement. I thought I was fully insured. But so if the doctor or system don't accept you, what you going to do?
Pick a system that accepts you. There are systems who are very easy to work with. Here locally, Dignity Health. They're super easy to work with. And primary care doctors are like gold. Nobody wants to be them. People will accept that line of work. They get paid very little a podiatrist, any of the ologists, dermatologists, right? They see fewer people. They get paid higher. So when you're in med school and you're investing, hundreds of thousands of dollars and years of your life on this education, I'm pretty sure the pencil pushing part of it was not what you wanted to do. But there are people who have done that for years, like your doctor, the older doctors. They were the primary care, like Marcus Welby, if people remember those shows. That's the doctor we want. I had great doctors growing up, taught their kids to swim. You knew them. There's none of that anymore. It's not. So.
Sickening and disgusting.
Yeah. There are doctors who got out of the system totally and said, don't deal with insurance anymore. I'm a cash pay doctor, and I'm going to see 10 patients a day, and you're going to pay cash if you want to see me. And those people who can afford to do that, can be very well served.
Aren't
by
there
those
some doctors that, I don't know if you call them boutique doctors, but you
concierge.
Concierge. Yeah. Okay. So that you pay a certain amount of money and then you can see them as much as you want.
Right. It's like a membership club, like joining a gym. You join a practice, you pay a fee every month, and then they're sort of on call for you. And if you have, diabetes, asthma, some of these really chronic sort of things, that can be money well spent because they're tracking you very closely, much more closely than these big systems can really do effectively.
And no insurance company pays for that.
No.
Right.
No. That's a personal choice issue. Some of them will give you a bill and you can try and get reimbursement for some, like the office visit or some of those things, but they keep the cost down by not taking insurance.
Yeah.
If you take insurance, you have an office manager, you have billing staff, you have all these people who have to work for you to code everything that happens in the office so that the computers can talk to each other. And it's all done by computer. The only human involved is the one at the doctor's office who pressed the buttons. After that, it's a computer talking to the insurance computer, kicking back a dollar amount. There's no human saying yes or no for the most part.
Yeah, but and I think I have one almost joined from Napa, and they had same like a membership. Country club, expensive.
Very expensive.
Yeah, $4,000, $5,000, $7,000 a year, and then. But the problem is, if you really had a big problem, you need a surgery or anything.
You
go
still
to
need
hospital.
Insurance to go to the hospital.
Yeah,
in the major
you can't
care.
afford it.
But the hospitals are not saying no to people. The hospitals
They
are
can't,
not.
right? By law.
By law, they can't leave you on the curb, even if you don't have insurance. But with your Medicare supplement, you could virtually go to just about any hospital except Kaiser's and get care. It's the primary care that's really kind of like the constriction in the pipeline, right? Everybody needs one, but we don't have enough of those. We got 1 million dermatologists, like around here, dermatology and mental health, because we're all crazy and have skin cancer in Santa Cruz County,
This is true.
So lots of specialists there, but not a lot of primary care doctors. But you need the primary care doctor to feed you in to the other services that you may need.
They call them gatekeeper.
Yeah, and that's still a term that we use, gatekeeper, doctor.
Yeah.
You know.
They don't like it all.
Well, Pam, I have the same, thanks to you, I have, and your recommendation, because I think the world of your you know more than anybody I've ever known. Even Dr. Wallach was impressed. He was on a show with you some years ago, a Saturday special just like this.
I love Doc Wallach. He's great.
Yeah, and he just thinks you walk on water, because I've never seen anybody who knows
Anybody
more about
that
the
can be a
system.
human doctor and a vet, I have a total respect for.
Well, anyhow, what am I gonna? I started saying something. Oh yeah, I have basically the same plan that Amy does. A plan F. I don't know why they call it F. F stands for failure.
No.
You know, but
The government's not very original in their naming system. Everything is an alphabet letter, which is what part of the confusion. When I talk to people, I try to leave a lot of the letters out. I tell them, translate this to these words that will stick
Right.
in your head. So
well, my plan F. When I joined it, I understood that it was the most flexible and allowed me to go to any of the doctors without a referral. Is that still the case?
It is still true. Any doctor that accepts Medicare and accepts new patients. That's what we now have to add to the sentence.
That's a condition.
It's
Okay.
It's not the insurance function. The insurance is like, as long as the doctor will let you in the door, you can go there.
I have become an expert on kidney stone procedures.
Yes.
Okay? I don't
An
think there's...
unfortunate thing to have to be
It's
an
true.
expert in.
It's true.
Excruciating,
Yes,
yes.
from like 2008 to 2011, I didn't drink much water. I didn't want to.
I was going to lecture you about maybe talking to your friend Doc Wallach about that.
Yeah.
But I know you enough to know that that's not going to help.
Oh, well, we can get him on. Well, I don't know. But and the point is, I started drinking lots and lots and lots of water, probably because of a medication I'm taking. But not before I'd had, I think, just about every procedure you can have for kidney stone. Now I don't have it. I'm totally clear. Thank God the kidney function tests I have every year
Are good.
say just wonderful, totally functioning kidney, and it's probably because
Because you've been behaving yourself better.
not
lately.
behaving. I have to.
Drink
Yeah.
a
I
lot
have to
of
drink
water.
so
Well-
damn much water. It's not my prostrate. It's not my prostrate. Like old men, they have to get up repeatedly to do number. Is it number one?
Yeah.
I get
one,
the
number
two.
two.
I get the two confused. Anyhow, number one is pee-pee, right?
Right.
Okay. So I got to get up a bunch of times, but not because of my prostrate.
Right.
It's
Because you had
because
to
I drink
tank
so
up
damn
on
much.
water.
Medication.
Yeah.
Yeah.
Well,
Decided.
the medication probably triggers my desire to, but it's a good thing.
It's a good thing.
That turns out to be, now it's not a good thing to wake up 3 or 4 times a night
No.
to do number one, but it's okay as long as I can discipline myself to go back to bed without looking at the email and 3 hours later ending
Yeah.
up, having watched 3 YouTube videos or something. Anyhow, I have learned, like my kidney, my urologist used to be with Dignity, I think. I'm not sure, but now he's with PAMF, which is Sutter.
They've
And am I
bought a
not going to be able to go to him? But I am going to be able to, even though my primary care doctor is with Dignity.
So sometimes the specialists, yes. And so this again is an internal function of how PAMF has decided to run their practice. So anything is subject to change if they internally decide this is how we want to run our practice. It's still a free
has
country.
this change happened recently?
In the last 2 years, since they didn't have a managed care HMO plan before. And when that came out and was introduced, that's when they drew the line in the sand and said, okay, any new patients into our primary care system must have this HMO model, managed care plan. They have a PPO version too. But you have to have a Medicare Advantage plan to come see us. Otherwise, no. But if you are already an existing patient, none of them ever knew anything happened. Now, if they go to the clinic, it's much like all the TV ads. There's constant reminders about how we would really prefer that you had this other insurance. But people do not have to, at least yet, do it. But
and
will
you're
they?
still recommending to me that I do not opt
You're
for one of
not a
those.
good rule follower.
Yeah.
And those plans are best for rule followers.
Right.
You know,
And,
after
and
the-
that is not you, from my experience. So that
Clearly.
is
no,
why.
I have one more question. But after the Sutter, they reject me, so I think maybe UCSF because they tell me I called them was November 19 or something, and they say that they accept the Medicare and
Yeah.
you have
And
a
the
supplement.
Dignity Health System,
And
which is
Then,
statewide.
then you know what's happened. So they centralized everything centralized. There's a calling system. You call the call center, so they will call you back. So next day, I call back. They say you call back tomorrow, and maybe you can have something opening. You can get a doctor. So I call back, and you know what they say? I was shocked. They say that today, November 20th, we started this entire division closed. No more new patient. So I say, what you say? If you're sick, you go to emergency room. That's it. I was shocked. I said, what's going on during this 2 years COVID? I didn't see any
It's
doctor.
a supply and demand problem. Think of any product. Right now we can't get computer chips and things. You
Yeah.
know, so we have cars that are sitting around. They're all built except for the computer brain that needs to go in them, right? Because we can't get the supply. And it's the same thing with the primary care. Nobody wants to be a primary care doctor. It's a
Wow.
thankless job. God bless the people who do it. But nobody wants to be that person. And so a lot of people coming in from, new med students or whatever, here they've gone to the extreme of some of the groups like Sutter had a program for a while. I don't know if they still do it, where they would get residents that are coming out, and they would make them be primary care doctors, work them to the bone for 3 years, pay them kind of the lower wages. But in exchange, they would get their student loans, which are hefty if you've gone to medical school, like hundreds of thousands of dollars in many cases, and they would get their loans paid off. So the doctors stayed for 3 years. And then they went back to Iowa or wherever it was that they came from because they couldn't afford to live here on the wages that a primary care doctor gets and buy a house
Isn't that
or, live a
So
lifestyle.
different from the way it
If they
used
go
to
back
be.
to Iowa, they have McMansion and, a lifestyle that appeals to them. So part of our challenge here is we're not the most inexpensive place to live. Beautiful though it is, there are people who are like, if I can't buy this level of house that reflects my status as a doctor, then it's not worth it. I want to go back to wherever it was they might have come from. So I mean, the systems, all of them, Kaiser, Dignity, Sutter, all of them are having a real challenge in attracting talent. Nurses,
Around here,
doctors.
yeah.
Well, around here or anywhere. I mean, it's Amy's in San Francisco. Apparently, it's not much better up there. When I have a couple that had Sutter here, they moved up to Sacramento, and they wanted to get another Sutter doctor up there. Same thing. They got told no. And they're like, but I'm not a new patient. I've been in your system for 20 some odd years. No, you're new to us because this Sutter and that Sutter are two different Sutters. And so they ultimately they chose the Advantage plan because they were okay with it. They did it for 1 year. They didn't really like it. So they went back to a Medicare supplement and drug plan system because they found doctors at the Davis system who still take Medicare and Medicare supplements. So it's a supply and demand challenge.
To really hurt the patient and consumers because you want to have the same doctor, right? If you doctor know you know doctors. That's
Well, yeah, but if the doctor retires, you
longer.
can't
Yeah,
do it
you,
now.
There's a very popular doctor here who's threatened to retire for the last 5 years that I can think of. And his wife has been like threatening to make him retire or hurt him if he doesn't. And finally this year it's like they're drawing the line and he's closing his practice. And I know I have a ton of my clients who use him as a doctor. They love him. Never heard anything about this guy but good. Never. I couldn't pick him out of a lineup personally, but I mean, if you say his name, I he's going to be sorely missed by the Dignity Health system. But they have worked hard, and they have. When I go into their system, I can find doctors that are in their system that do primary care and are accepting new patients. So those doctors are available, but they're.
Right. It's 10:43 here on the Saturday Special on your favorite radio station, KSCO. Our special guest on the Saturday Special today is Pamela Fugitt-Hetrick, the host of, for many, many years, of Money Moves, Thursday evenings, 7 to 8 p.m. So if you haven't heard Pam before, I'm sure you're quite impressed today. Be aware that you can call Pam during her show any week. Once in a great while, you take a vacation. We plug in a rerun
no
or something.
vacation
Right?
this year.
Yeah, no vacation this year for sure. Yeah, so that's
I
Pamela
already bought the
Fugitt-Hetrick.
farm on vacation. I'm
and
tapped out now.
Right. And co-hosting the show with me today is Amy Howe from the China Watch Radio Show. And we've had a one caller, though we haven't invited calls. I guess we can do that now, right? If you want to have any questions about the healthcare system, many, if not most, of the KSCO audience is of a mature level in age.
I like that, mature.
Yeah, mature, yeah.
Yes.
And I
Only my voice sounds young. Sadly, my birth certificate looks mature.
If you want to call and ask Pam a question or make a comment, 831-479-1080, or you can email mz@ksco.com. But let's go to the phone lines now and take the first phone call from a man who we have to give an award for having the longest standing number of phone calls, every one of which is more than worthwhile. And, you can always count on Rory being a fabulous caller. So here he, and I was listening to a show, a rerun of a show with David Corsi and Rob Roberts that was done in 1996. And there was Rory and calling
in.
Yeah, I mean, back then, and sounding exactly the same as he does now and asking the same degree of intelligent questions and comments. But here you are, Rory. Welcome to the Saturday Special.
Well, hey, thank you for that. I must say I've learned a lot listening to your radio station and the different programs over the years. It's helped tremendously. So happy Thanksgiving to you and Pam and Amy. Couple things I take away so far is, number one, Joe Namath doesn't know what he's talking about. Don't get sick.
Yes.
And third, there are death panels.
Yes.
Right? There's death panels, right, Amy?
Yes.
Go home and die.
Yes.
But so a couple observations. And I look back about that time. You said that was the mid-'90s when I was listening to Corsi, who was irritating, and Rob Roberts. Right, MZ?
He's still on. He's
I'll
still on at 12 noon with a pet show on Sundays. Yeah.
Oh, that's right. Well, he's mellowed a bit, but man, coarse was the operative term there. But anyway, about that time is when Wallach came on. What year? He came in, mid-'90s, 94, 95. Right?
Well, the call I got was in November of 94. But it was in September of 96 that he went on full time, that he went on every day, including the weekends.
Okay,
yeah.
So about that time, so it was right before Wallach came on the radio. After one of the kids was born, my wife got gallstones. And our doctor, they referred her, and they said, you got to get rid of your gallbladder. She's like, get rid of my gallbladder? Like, what the heck? But it was painful. And then a friend said, "Oh no, you just do the liver flush. I forget the whole. It was lemon juice and olive oil. Those were the active ingredients. And by golly, no more gallstones." And she passed it on to several other ladies over the years. But that opened my eyes. The pharmacomedical model, the allopathic model, is the most expensive and probably the least effective modality
Agreed.
of healing.
Agreed.
So that coupled with Wallach has been a real boost to our lives, not just me and my wife and our kids. So anyway, so kudos to the longevity movement, the Mighty 90. I think the more we do that, the less we'll need doctors in general.
Yeah.
But I don't begrudge the medical doctors. I have a friend that's doing the concierge. And so for you, Pamela, quick question. So I'm 61. I got to work longer because I had more kids with less money on the front end. But my goal is to keep going, at least work till I'm 70. And so what happens at 65? My understanding is you got to take Medicare. Your insurance that you get through work just ceases.
It depends on where you work and the size of the business. If you work for a company that has more than 20 employees, you can stay on your work insurance and not have a penalty.
Okay.
You can elect the Part B later when you actually retire. And then move to Medicare then.
Good to know.
If you are in a company, like I work in a company with less than 20 employees, so I would need to have Medicare as my primary, and I could have my work plan as my secondary, like a supplement, or I could move to a Medicare supplement, which would be more cost effective. Or move to an Advantage plan at that point if that was my choice. But so the answer to that one is always like taxes. It depends on the size of the company that you work for.
Yeah.
I know. My best friend that I'm
that's-
doing stuff
that's
with
good.
this afternoon is a tax person. So between us, it's hard to get a straight answer on anything because our standard answer is it
Well,
depends.
that's very helpful. So what was I going to say? Yeah, my health directive, and I know there's more to this, but my health directive to my kids, and I'm going to put this in writing: no heroics. Give me a morphine drip and put me in the garden and keep the gin and tonics coming or whatever.
Yeah.
But I'm serious.
Put it in writing.
I don't want to go into this. Oh, I am. I'm working on it right now. But I don't want to go into what appears to me is a squeeze on primary doctors with the advantage to the mega insurance corps and drug
You know
companies.
how
It's
much
like
they're
driving
paying
the
for
ship.
all those ads and
Oh
all
my
those
God.
figureheads. The
Oh
amount
my
of
God.
buckage that's going out to those TV stations,
It's
they must
unbelievable.
love open enrollment. He said they must love it.
Well, I don't watch a lot of television, but I've seen. I mean, I watch the weather news occasionally and a show here and there. Very here and there, but
Yeah.
that's all I see. is those
Even my own
advantage.
clients,
And
many I've had for like 15 years now, and they're calling like, "Are you sure that I'm not missing out on something?" I'm like, "I assure you, you're not." But I have people that I talk to over and over during open enrollment. If I get 30 minutes with somebody, that's a good day. And then they call me back for a second and third 30-minute thing just because they're sure that I must be missing something.
Yeah,
And-
they're selling the sizzle, not the steak. And I'll leave
Right.
you with this. My mom's primary doctor, when all of us were being born along there, Dr. Gannon, he quit when they made him, by law, take liability insurance. He had never been sued.
Yeah.
He says, I'm not taking insurance ever. And so he retired. And, that's back
It's
in the day.
another
Get
big
this, Pamela,
cost
and we're-
driver because the insurance, their medical liability, professional liability insurance, if you're a doctor, oh my God, especially if you do like OB or
That's
or
another word
specialties.
for malpractice insurance,
Yes,
right?
uh-huh.
Yeah, but that was mandated by law. Up to that point, it was involuntary. So a lot of this is being driven by legislation. And I look back when we were kids, my parents, when my mom put all our stuff aside, I got my file. They kept my parents were just kept all the records. There's a bill to go see Dr. Wynn in Pasadena, $5. They paid all that stuff out of pocket.
Right.
Insurance was not involved
That
in
is
the
where we
day-to-day.
went wrong
And
here
now,
in the U.S. was having insurance for the little things. It was designed to
Yep.
be to take care of the hospital stay or the emergency, not the everyday mundane things that we
we need
do.
to go back.
We need to go back to that.
I love the health insurance. I forget what they call it. Obamacare outlawed them. The health insurance accounts where you and the employer would put money in that account.
Medical
and it's
savings
yours.
accounts?
And then
Yeah.
you could,
Yeah.
yeah, and then that's your money. You can use it for optical, dental, whatever you want.
They
If
still
you think
have
you got a
it, but it's
discount.
only for, you have to have one of the high deductible bronze plans that eliminates a lot of the benefits. And it used to be where
Interesting.
those health plans were super cheap compared to a more robust plan. Obamacare kind of ruined it, and now they're all about the same price. So you don't have the savings to put away for most people. I still
don't-
have that kind
I
of
don't
plan.
know about
but-
now, but I remember Doc Wallach used to say only have catastrophic health insurance.
But Obamacare
Yeah.
eliminated catastrophic insurance, and then we had short-term insurance, and the state eliminated that. So in other states, you can buy a policy that's only good for 6 months or 1 year at a time. But Governor Newsom kicked that to the curb because the government wants you to have certain things, and they will make your life miserable if you choose to live outside of their system.
Yeah, we're just starting to get a taste of it with all the Rona mandates. And
I
all
love
that.
it
So anyway,
when
thank
Congress
you,
is not in session in their home because they can't hurt me when they're eating turkey with their families. When they're actually at work, I kind of sweat it a little bit.
Yeah, who was the great humorist that said when Congress is in session, every man's wealth and value is at stake?
Right, exactly. That
Ben,
is
help
my
me out.
sentiment.
Was that Will Rogers?
It might have
Yeah,
been.
Will Rogers.
He had some
It
good
was,
ones.
and I'm paraphrasing. The other one, he said, when the Great Dust Bowl happened, all the Okies came to California. It raised the IQ of both states.
You know,
Think about that.
talk
All right, you guys.
about.
Thank you. You're very helpful.
Thank you.
Bye, Rory. Yes, Amy.
Take care. Bye-bye.
Bye.
Talk about the insurance. I was thinking, for last 2 years because of COVID, we cannot go to doctor. I didn't go to doctor at all, but they still increasing the premium. We didn't even go 2 years. How much you pay every month?
That's a very good point.
Yeah, I mean, but
a
no-
lot of it is, again, the pharmaceuticals. Like there's a new drug coming out for Alzheimer's. We're not exactly sure that it actually does anything. The FDA is like, well, yeah, I guess it's not killing anybody, so we'll approve it. But we don't know if it works. It's $154,000. So think
Wow.
of every senior that you know who thinks they have Alzheimer's, or the ones that actually do. They're going to want this medication because when you have Alzheimer's, you've got nothing to lose, right?
Okay.
Whatever comes down the pike, we're going to try it
Our
at
next caller.
$154,000.
I can't wait to
Wow.
hear from our next caller. It's 98-year-old Mary in Aromas.
Go,
Hey,
Mary.
Mary, what are you thinking about all this?
Well, I pay $500 a month, and I'm 99.
Oh, you're 99. Excuse me. Yeah. Whoa.
And you had a birthday.
Yes, I did.
Good for you.
It's always better than the alternative.
Right.
Ladies, you're very informative.
They can't help it.
I'm enjoying the program.
Wow.
Anyway, I have Anthem and my Medicare, and I still pay $500.
Yeah, we need to talk, Mary. We got something better for you.
Yeah, really.
You can have the
Put out your phone number, call.
the Plan F. Then it's $297 in Santa Cruz County. Oh, you're Monterey, so yeah, it's like $297 to get the top of the line plan. So we need to have a chat because you're on an older plan that people don't review it. This is part of like a challenge. I have clients like Mary a lot that come in and they show me what they're paying and I'm like, oh dear God. And then I look, they haven't reviewed their insurance or what's out there in decades often. And so, yes, there is something we can do for you. If you call the office,
I'll give you the number before I hang up.
yeah,
Okay.
And MZ, did you have a nice birthday?
The best. I forgot
did
what
I.
I forgot what I did, but it was the best.
I had
that's what I
4
remember.
parties
Yeah, one was out of state, huh? In Arizona,
in
right?
Arizona.
Yeah. Well, that's great, Mary. Wow.
With
And forgive me, I
live
thought you went from
entertainment.
97 to 98 when you really went from 98 to 99.
Yeah.
Yes, I'm 99.
God bless you.
I had 4 parties.
Oh.
You
wow.
should.
Yeah.
I know, and it's too bad we don't have Willard Scott. They got to have somebody take over. When people turned 100, they would always put him on TV. And I know my great-grandmother made it to 100, and that was a thing that everybody was like looking forward to Willard Scott saying her name on TV.
Oh.
So.
And then he died.
And then he died. Yeah. He was a class act.
Yeah. Oh, shucks. Well, Mary, we still haven't had our celebration. We have to do that. We have to arrange for that. In fact, here, just to remind myself, I'm going to take a photograph of your phone number here. So, okay, good. How can I thank you for calling?
Oh, just that. Your thanks is enough. I love you, love you, love you. But now you laughed.
Okay. Ditto.
Now you made my day.
All righty.
Okay,
Thank you.
if I stay.
You made our
on
day,
the
Mary.
line and give
Thanks.
somebody my number.
Okay, I will give Pam your number. That's
Yeah.
the best way to do it. Okay, and Pam
Well,
can
how
give
do
out
I
her
do
number.
it?
423. Well, you'll get a call from
Yeah.
Pam.
MZ will give me your number. He just
Yeah.
he
All
took
right,
a note with
sweetheart.
his phone, and if you want to call my office, it's 831-423-8542.
And ask for Pam. Okay, so
All right.
good. We have exactly 1 minute left before the end of the first hour. Thank you, Mary. Love you. Bye-bye. That was Mary in Aromas. Amy and Pam are here with me in the studio at KSCO for the edition of the Saturday special. Everything you want to know about Medicare and health care if you're an old fart. Right? So
Hey, old fart is relative in this area. I just had one of my Medicare clients call from the hospital. I'm like, wow, he's really one of my super healthy ones. No, he got hit by a deer riding his bicycle. So,
Oh.
you know,
all banged up.
yeah. I mean, the good news, he's going to be fine. He's got a few dents he didn't have before,
Wow.
and his Medicare paid everything. But, you know,
If
that's the kind of senior citizens we have here.
Yeah, good. Thank God. Okay, we're at the end of, if the clock is right, we're at the end of the first hour. KSCO
Is a little bit of a slowdown as you get into King City north and southbound lanes. In today's forecast, current temperatures are 57 degrees, sunny with a high near 71. Calm winds becoming southwest 5 to 8 miles per hour. Tonight, mostly clear with a low around 49. Tomorrow, high near 72, light winds. And into Monday, high near 70. On the seas today, northeast winds 5 to 10 knots, becoming westerly this afternoon. Wind waves 1 to 2 feet, with swells 4 to 6 feet at 14 seconds. KSCO King of the Hill traffic time is 11:06. And now, hour 2 of the Saturday special.
Now I'm hearing, yeah. Okay, Dave Michaels.
Good morning, MZ.
Okay, you have a long list of things to talk about.
I do. Well, these are actually reasons to maybe head down to the Shadowbrook to celebrate. Right now, MZ, it is a little after 10:06, but this could be a replay, so the time isn't really so specific. Any time is a good time to celebrate your anniversary, having a baby, getting a new puppy. Head down to the Shadowbrook. Anytime, MZ, is a perfect time to head down to the Shadowbrook restaurant to celebrate that special occasion. I might recommend if you get a new puppy that you also get some Arthrodex for that little puppy. Now, he might be a little young, and it might not be the best thing. It might give him a little too much energy, but it's good because it's going to give him the nutrition so that he stays and becomes an old dog, a good old buddy.
Wow.
Yeah.
Okay, so
Yeah.
Shadowbrook time.
Shadowbrook time is right now.
Is all the time,
Go-
really.
go
And
online,
Amy,
I'm
you
sure.
have nothing but you've been to the Shadowbrook a number of
Yes,
times.
fantastic.
And Pamela, My God.
Yep.
It's been right under our noses for all these years. But
I
we
grew up here. That was always the date place, right?
Oh.
For prom,
Right.
whatever.
For that special
That was
occasion,
the place.
It is a really nice place, especially if you're from, from out of the area and you don't know where to go. The Shadowbrook is
what
the place to
people
go.
don't realize, of course, it's a special occasion place.
Sure.
Absolutely, positively. I can't think of a better special occasion place.
If they've never been
But
there.
it's an ordinary occasion place too. That's what people don't know.
Sure.
You know?
I guess you could
The
think of it.
wood-fired pizza in that upper level for everyday
It's a
stuff.
beautiful place.
Yeah.
It feels like you're in an old cabin or
Oh
something right
my
there on
God!
the
I'm wondering if
riverside.
the people at home, if their radio was wet, because my microphone
know.
is.
It's a
drenched.
fantastic-
Now we're all
I'm
drooling.
drooling
Thanks,
all
Dave.
over the
A
microphone.
fantastic restaurant. So again, since we're talking about eating, stop by, get your ultimate enzymes, your Flora FX, your root beer belly, or your ultimate herbal classic. Rainforest.
Yeah,
Whatever.
Hook me up with some Orthodox for the boys, please.
Okay, you got it. I'll save some for you. I'll be out there till 2, MZ.
Okay, thank you, Dave Michaels. That was Dave Michaels and his orchestra. And now, 3, 2, 1.
Oh, hello, darling. I hate to hang up on you, but I'm sorry, baby, but I have to go. It's time for that wonderful record show. I'd love to visit, but you'll have to call back. KSCO has the inside track.
Now, if you like KSCO radio, which I'm sure you do, how can you not? Did you ever think of turning someone else onto KSCO radio? You might think about it.
I'm sorry, baby, but I really gotta go to KSCO radio. Bye.
And with that, we will continue our discussion about health care, especially for mature people. What's so funny?
Age-wise,
Yeah.
we might have not matured otherwise, but
Never
on our
matured.
birth certificate,
That's right.
we
That's
have
right.
aged and matured.
Right. I have not matured. I never grew up,
Never
right, Amy?
grow up. Yeah.
Yeah.
Yeah. So I still,
Peter Pan is
Peter
alive
Pan.
and well.
I still find humor in toilet humor and stuff like that. It's so juvenile. Anyhow, if you want to call us, we'll open the phone lines. If you have any questions about your Medicare, all these Medicare Advantage, it just clobbers you with all the media these days. There's hardly anything else besides Medicare Advantage and Mike Lindell's My Pillow and My Slipper and My Everything.
My everything, yeah.
Jeez. Yeah.
I think it would be good to just point out the difference between Medicare and Medicare Advantage, because even Dean Sutton, who has the legal show right after mine, I have to correct him almost every single night because he will expound the wonders of Medicare and Kaiser. I'm like, no, you don't have Medicare and Kaiser. You have Kaiser Senior Complete. And this is why I only half listen when people tell me what they have, because they don't use all the words, right? I have Anthem. Okay, that's like telling me you drive a Ford. Is it a Pinto? Is it a pickup truck? Is it a van? What? It's a brand. And that brand has an Advantage plan, a drug plan, a supplement plan, or whatever other kind of plan. It's a brand. And we get stuck on, I have United Healthcare AARP. Like, you got Plan F. You could get it from anybody.
And
that
then
happens to
within
be a
that,
good
there's a
one.
bunch of them within that, too.
Right.
Like-
And then,
Yeah.
yeah. So people use the words interchangeably. And a lot of times I have people like, I called and they told me yes, no, or whatever. And I'm like, what did you tell them when you called that you had for insurance? Because I just asked you and you couldn't tell me. And so, I told them I had Anthem. So they don't know if that's Anthem and you're under 65 and that's a certain network of doctors, or you had Anthem from your employer. That's a different set of doctors. You have to use more words in the sentence. And I always try and encourage people on my show to A, open the mail, B, read whatever it is. And if you don't understand it, God knows it's complicated, then get somebody who does what I do, whether it's me, your agent, whoever. I don't need to poach anybody's business. But
Oh, go ahead. Might as well.
no, but if they have somebody to go to that person and don't be ashamed. Go, what does this really say? We have plans that are going toxic this year that they were $30, $15, whatever this year, and the plan is closing, and they have sent out a letter that says, I am going to move you to this new plan. If you don't want to go there, pick something else. But nobody opens the mail. Nobody looks at things. How many times have I called and badgered you about changing your drug plan this year, which is every year, by the way. You're one of the worst.
I sure am.
And, it's like, no, because we're so violently like, I don't want change. Like, we're done with change. We're tired of it.
With me, I don't want complication. Don't give me decisions to make.
The
I've got too many
complication is
already.
if you put your head in the sand, if you wake up in January and now you're paying $86 for a plan you were paying $15 last year, and you're going to go, hey, Pam, what happened? What happened was you didn't follow my directions and open your mail and look and see what was happening. Because right now, until December 7th, we got very little time left to fix the problem. If you call me on December 8th, I'm like, too bad, so sad. You get to keep whatever that is for the next year. I cannot fix it. The door is closed. December 7th, when we go home at night, that's it. Whatever your problem is after that.
And then you get to go on a little vacation.
No, because I still have all the group health people and Covered California people. We have 3 open enrollments going simultaneous, thank you to Obamacare. And so for anybody who does health insurance, this is like our tax season, right? You've seen how, wiped out tax people look in April trying to, function with everything. Health insurance agents right now are like that too. People are like, what do you mean I can't get an appointment till December 3rd? That's the next one I have available. I'm working 7 days a week.
December 3rd is only a few days.
I know, but it sounds horrible when
it's August.
They want to talk to you like
August.
right now. I'm on the phone. Let's talk right now. And it's like, I have other people who have scheduled weeks ago to have this time, and it's theirs. But, I have other agents that I've trained that I work with, but people like to talk to the person they talked to last year. And I love talking with my clients. I have some of them, like I know about their dogs, their kids, every year. Hey, how's the business going? Did you go back to Paris? Because I have clients that, they have things that I know about them, and it's enjoyable to chat with them. Unfortunately, during fourth quarter, it's sort of like business forward, because we got to get it taken care of. And if we have anything left in your time,
people call the chat and you're tearing your hair
and I'm
out
like,
under
let's fix the
deadlines.
immediate problem. And if we have time left over, I would actually really love to talk about your dog or your trip to Paris or whatever it is. But there's some really fun clients that I actually really look forward to, and I miss seeing them in person, because last year, because of COVID, the office was closed and everything was by phone and Zoom.
But this year you see more in person.
This year I've still been seeing them by phone or Zoom, only because, one, we spent all last year teaching a lot of senior citizens how to do Zoom or how to do an electronic signature. And then a lot of them, honestly, are like, can we do it like last year? Because I don't want to fight the traffic to get down to your office or figure out how to park and all that. So honestly, a lot of people like it. I have a couple of clients that are super hard of hearing, or they're inbound. They're not going anywhere. And so I do still try and hit them in the evenings on the way home or on the weekend and get them taken care of. But it is way more efficient with the electronic applications and things that we have. So that way I have 30 minutes to spend with them on really diving into their medications or what they really need. It's not for me to tell them what to buy. It's for them to tell me what they want, and I tell them the closest thing to what you just asked for is this. And now they know what would suit their thing. Because I can work with Medicare supplements or Advantage plans. I don't discriminate one way or the other. There's what I would do for myself, but everybody's in a different position. If I was like Mary, and now, I'm living on just Social Security or, a really fixed income. Would I want to pay $400 for a Medicare supplement? No, probably not. I would make a different decision. But, it's to each their own. But that's how I like to
each
work.
his or her own.
I love it that it's still a free country. God bless America. So
Did I just say something politically incorrect by saying to each his or
in
her
Santa
own?
Cruz, maybe.
Should I say to
I've
each?
never been very politically correct,
To
so
each
maybe
it-
that's why I like this station.
To each its own.
His
Should
or
I do
her.
that?
You said his or her. That's equal. Whichever you might identify with.
I'm seeing lists of people now that have pronoun. I never saw that before.
No.
I just
Well,
noticed
my
that this
office
last
is
week.
a couple doors down from the Diversity Center, and I've worked with a lot of people from there. And it used to be on your Medicare card, it was your name, your Medicare number, which used to be your Social Security number, which was stupid. And then the dates that you got Medicare.
It was stupid.
And they finally 2 years ago fixed that, but only 2 years ago. Now it's
Yeah.
this gobbledygook number that is hard to identify back to somebody. But they had if you were male or female. And I had a number of
Some
trans.
say declined to state, right?
Well, no, on the card, you were one or the other. But now that's not politically correct. So I've noticed now the Medicare cards do not have anything about your sex. Because it got to be challenging. I would have these transgendered folks that would come in, and I'm like, I'm personally cool with whatever you choose to identify with. But on your card, when I do this application, it has to match. So could you tell me what sex your Medicare card said? Oh, no, I'm fully transitioned and I'm female now. Great. I'm happy to check whatever box it is. It's not my call. But I used the name, the number.
What does fully transitioned, I'm a female now mean? Does that mean that their package is gone?
Yes.
And it's been replaced
And
by
they have gone through a tremendous amount of paperwork. You know how hard it is just to change your name when you get married or divorced and you want to go back? I can't even imagine what these people go through, hassle-wise, to get their sex changed. But, I mean...
Is there any trans...
They had to change their birth certificate?
I honestly don't know what the full process was. My job was just whatever I put on this application has to match the card. But... I can only imagine that it's a tremendous challenge. That might be a good one for, don't we still have out in Santa Cruz or some of the other shows that are on to tackle the subject of what the paperwork.
What I want to
involved in
know
something
is,
like that.
is there
not just the physical part.
Are there any transgender people listening to this show, the Saturday special, from November 27th in the year of our Lord, 2021. Yeah. Is there anybody, any transgender?
It would be interesting to know
Please
their
call in.
perspective of how the healthcare system is
831-479-1080.
helping or hindering them getting care.
If we don't get a call, any call from a transgender person, I'm going to feel very sad. I'm going to feel that either the audience isn't as large as I would like to think it is, or what could the other thing be?
Well, one thing I can say from the insurance perspective, at least in California, I'm not licensed to work in other states, and California is plenty big enough, more than I can handle. So, at least here, your sex is whatever you put down on the paper now, of your choosing. They have even some options that honestly, I'm not even sure what some of them are. Which of these do you identify at?
Wait a minute. Are you telling me that I could put down F for female on an application and that's what I am? As far as the law is concerned?
As far as your health insurance, it may cause some problems with your medical records that doesn't match, but yeah. I mean, there's male, female, non-binary. There's some other options. There's in covered California. There's trans male to female, female to male. I mean, there's a large number of assortments. It's like the same thing as when we used to say we're Caucasian, Asian, Mexican, Hispanic, Puerto Rican, or declined to state. I mean, the sex column has now gotten to be just about that complicated.
Jeez.
Yeah.
Where are all the callers? 479-1080. And I want to hear from trannies only for the rest of the show.
No.
Did I just ensure that we're not going to get any callers?
Probably, yeah. Yeah.
Okay.
You might have just offended the same people that you wanted to call in.
The jury will disregard that last comment.
It's a safe
From
place
the
to
stupid
discuss the
host.
issues that you deal with health insurance. So.
Yeah. But the number is 479-1080 in area 831. The email address is nonetheless mz@ksco.com. And there is a lot to talk. We're not talking politics now.
No.
Maybe that's why the phone's not ringing as much as I like it to ring. But you get some phone calls on your show. It's about the same call volume on the Saturday specials.
A lot of people that listen to my show, they're listening for the content because I try to stay non-political. My friends that know me know that I'm political, but it's not my place on the radio. Mine is to put out content about your personal finances and how to do well with your money and make good decisions. And so that is not a political thing. Every once in a while, there's a new law or something that we have to address. The fact that it's, a politics made us make that choice. But I think one of the important things is to discuss things that affect everybody. And the biggest thing right now is all the people concerned that they're missing out because they're seeing things on TV. I can have dental, I can have vision, I can get my Medicare paid for. And there are places in California where that is true. It doesn't happen to necessarily be here unless you're very impoverished. And then there are programs that help people get those things. So when they say we want to look up your zip code, it's about the zip code and how much money you make, whether you qualify for some of those things or not.
Well, I mean,
in the fine print,
does the zip code tell you how much money you make? I mean, that's sort of presumptuous,
No, the zip code tells you if there's one of those plans available in your area. So the plans that have a buyback for your Medicare don't exist in Santa Cruz or Monterey County, but they exist in Santa Clara and LA.
Pam. Mm-hmm. Would you like to talk to Shelley in Monterey?
Sure.
Amy?
Yes.
Would you like to talk to Shelley in Monterey?
Sure.
Okay, that makes it unanimous.
Now he has to find the button, though.
Shelley in Monterey, welcome to the
Hi,
Canada.
MZ.
Hi, welcome to the Saturday
Hi,
special.
Amy.
Hi, Sharon.
Hi.
It's so good to hear you all together. You
Thank
guys do
you.
a fabulous job.
They sure do.
Pamela, how do I spell your last name?
Fugitt, Fugitt, and then it's hyphenated just to make life a challenge. Hetrick, Hetrick. Don't get married in the military. They'll never get your name right. I ended up with that.
Well, my daughters actually have my last name and then hyphen, and then they have their dad's last
Yeah.
name. So.
It makes life in government computers challenging, but hey.
Yeah, my daughter is a Marine, and she just uses my last name.
There you go.
It's too complicated to use both. Yeah.
Yeah.
Okay, so your phone number is 831
423 8542. That's the office number.
Okay, I'm going to keep that. Okay, my question is I'm about to medically retire, but I'm waiting for the approval, and I don't know how long that'll take. Should I go ahead and, because I do want to keep my employer benefits, but I am going to be 50 on the 10th.
Okay.
So should I go ahead and enroll in a Medicare?
No, at age 50, unless you are eligible for Medicare, you've been declared disabled for 24 months, you're not eligible for Medicare. So Medicare is normally when you turn 65. or for people who Social Security is declared disabled, after 24 months, you're eligible for Medicare based on the disability. So if your disability is not through Social Security and you haven't had that for 24 months, you're not eligible for Medicare. You would want to make the decision about taking COBRA from the plan that you had, which is just taking over the payments of what you have, or looking into financial assistance through maybe Covered California on an individual plan, because if you're now retired, you don't have, a significant income coming in, there's government assistance for that.
Okay.
And so we could talk to you about that in the office and kind of identify what you qualify for and what you're not. And sometimes taking COBRA is the best thing for people. Continuity of care and costs. If you worked for a large company, it could be much lower than what's in the private world. And sometimes it's the exact opposite. So again, it's that thing of it depends. And we really have to get a lot of information before we can give you the right answer.
And you're still doing the Zoom appointment?
Yeah, we're doing it. Most things we can do by phone, but some people are just so completely visual that without pictures, or something to look at, like the words just doesn't resonate for them. So we'll use Zoom in those cases. But we do have an intake form. So if you call the office, ask them to send you the individual intake form. And it gives us the basic information that we need to kind of look at and go, oh yeah, this person qualifies for something or doesn't. And it also helps you collect the information that we're going to ask you. Because there's nothing worse than waiting 2 weeks to get an appointment and then you don't know the answers to the things that we have to have in order to help you. And so
then you get put off another 2 months. Huh?
Yeah, it's like we have 30 minutes. So, and there is no charge for the consultations. That's completely free. I get paid by whatever insurance people ultimately pick up. So I don't have a vested interest in your personal choice. And that's why you don't have to pay to have any assistance that way.
Okay, and because there's a little bit more detail to my situation.
Oh yeah, most of them are
radio.
exactly. And when I have people call my show, I'm like, feel free to be Snow White, your favorite dwarf. I don't care, because no one wants to talk about the personal stuff on the radio.
I love listening to your show.
Thank you. Yeah, but you're welcome to call the office.
Except for when I'm guilty
of not opening your mail.
When I'm guilty of spending my money wrong.
Well, trust me, a lot of those experiences is because I did it wrong myself once. Just trying to help somebody not do it like I did.
I know you've said that many times, and I love it when you share about your daughter and and the struggles about school and
now
anyway,
she's
I love your show.
The most talented strawberry grower that sings opera.
Wow.
Yeah.
Okay. Well, Shelley, thank you for calling.
Thanks for the call, Shelley.
479-1080. Now we're going to go to Luis. Hi, Luis. You're on. Luis?
Hello.
Hi, you're on.
What I wanted to do was, since I know that Tom Quinn will be busy with calls already lined up, what I wanted to do was to leave him a voicemail. Can I do that?
Sure. We'll put you on hold, and you can do that, okay? But wait a minute.
Yeah.
I don't know how to do that. I don't know how to send you into voicemail. Why don't you just...
It's the other phone number, isn't it?
Well, wait a minute.
475.
Can I give you the message right over the line?
Well, I don't think the audience would like that. Mm-hmm. Because you're live now to thousands and thousands and thousands of people. And I don't think Tom would like it either.
Okay, so
let me put you back on hold, okay? Well, call 475-1080, not 479-1080. Yeah,
okay.
You called 479-1080, and that's the number for people who want to go on the air, which is what you are now.
I didn't want to go on the air.
Well, it's too late now. You've already been on, and we can't take that back.
But we all say hi anyway.
Well, listen, when you get a real dummy bunny like me, nobody wants to listen to me.
Okay.
So I'll stay online until I can...
Well, no. Call back to 475.
I can't call. wait a minute, I can't call back.
Oh, I'm sorry. Well, then I'll
Because
put you back on
so
hold.
am
then.
I.
Okay. Okay. Whatever the reason is, now take next. That would be Jim in Pacific Grove. Hi, Jim in Pacific Grove.
Hi, thanks for taking my call. And I'm sorry if you covered this already because I joined in progress.
Oh.
But I'm a retired state employee. And this year they sent us a notice saying that you're going to have to change your plan, and it's going to be more expensive probably if you don't do anything. So I chose the Anthem Blue Cross Select, which is an HMO, and I had been in a PPO before. And so I was wondering, is there a disadvantage to being in an HMO compared to a PPO that would translate to someone who typically does not go to the doctor very often?
Well, if you don't go to the doctor very often, or you're not super set in your ways, an HMO can be fine. When you get your card from them, there will be a doctor's name on it. That is your go-to doctor. So unless it's an emergency, you need to contact that doctor and get a physical, or, get moved to a specialist, or, you have to follow the rules in an HMO. And that is a much more restrictive list of doctors. I try to give people visuals, so think of, the PPO is like your dinner plate size of options, where you're looking at more of a saucer size list of doctors that you could go to. Not as many doctors accept that plan.
Do they randomly find me a doctor? Because
if you did not put your doctor down and confirm that your doctor was part of the HMO, yes.
Okay, because they sent a big list of doctors.
But when you did your application, it would have asked you who is your primary care doctor. If you didn't put anybody, then you'll be randomly assigned one. Hope you like them.
Well, I hope I don't have to see him.
Well, that is, I totally applaud that. Just because I have health insurance does not mean I want to use it or get my money's worth.
Right. Thanks to this show and all the good advice, I can stay relatively healthy and not have to go to the doctor.
There you go. That's always plan A,
It's
honestly.
nothing but good advice that we offer here on your favorite radio station.
Well, it's true. Doc Wallach has great advice, and I follow that. And then the Duncan, he's got great advice.
Dr. Duncan McCollum, who's coming up later today, I think. Yeah. So
he helped me a great deal recently, so I really appreciate it.
We hear stories like that time and again. Anyhow, Jim in Pacific Grove, thanks for calling 479-1080. Here we go to Linda in Hollister. Hey, Linda. Welcome to KSCO.
Hi.
You're on.
Hi, what a wonderful show and very timely. And I was chuckling when you were talking about all the infomercials that are coming on. And I have to admit that I finally was struck by one because it was Joe Namath. And well, there's a reason. I was at the University of Alabama the year after he left Alabama. So feel kindred spirits. But anyway, I did call, responded to the call, and it, just as you said, Pam, I found out that, of course, it
doesn't happen in San Benito County, yeah.
Yeah, yes, he, that was once upon a time. Mm-hmm. It's interesting how well preserved he looks. He looks kind of pickled, though. Yeah. And it made me realize that I'm mature now.
Yeah, we've all gotten a little older. It's a blessing, I guess, right? It's something we get to enjoy that some people aren't ever granted. So that's how I look at it.
Right, and consider the alternatives.
Exactly.
So here's my question. Fortunately, when I did call, I was told that we probably, unless I really needed the advantage, to stay with what we currently have, which I was kind of leaning to that. But
I'm glad they told you that. That speaks to the fact that it wasn't a total scam, that they were honest with you, which I appreciate hearing because it's not always the case out there.
Yes, but I did end up adding the visual and the dental, and then I started thinking about it, and so I tried to get them to give me a discount because I literally have no vision in my right eye. So I said, well, you should give me half off, right? Because I only have one eye. And
I don't think that worked for you, but I applaud the effort that you tried to negotiate with them.
They wouldn't go for that. But my husband wanted me to ask, the difference between AARP and AMAC. Because currently we have AARP, and to be quite frank with you, I don't agree with all of their...
I don't either, but they do have... Neither are insurance companies. They're both political organizations, AARP being the larger one. And AARP has essentially sold their name to get marketing dollars to United Healthcare. So United Healthcare is the actual insurance company. They work with Hartford on their other like auto insurance, and there's a lot of companies that have basically paid a royalty to AARP to be able to co-brand it with their name, because there is tremendous name recognition, sometimes for the good or sometimes not. I have people that even if AARP is less expensive, they won't buy it because it's AARP. AMAC does not have a discounted Medicare supplement program that I'm aware of.
Okay, so here's my next question, and thank you for answering all these questions because this is a decision-making time.
Yep.
We have United Healthcare as our primary, and then we took Humana as our prescription.
The Humana Walmart plan?
Yes, but Walmart is so far away from
You don't
Hollister
have to go to Walmart. That's just where the discounts are. Or you can use their mail order. Humana has their own mail order.
But this is my question. I'm still having a copay. I only have 3 medications. My husband, he looks like a pharmacy. He gets so much, and so he never has a copay. I have some drops
It's about
for my
which
eyes.
drugs you take. So I have people that have 20 and they pay nothing because they're all the super cheapy generics. I have a person that has 1. And if it's anything that's advertised on TV, that's a $500 plus kind of drug. MZ, you know that one well.
I sure do.
Yep. And so that orange one, that, it's expensive. And so that person is always going to have a fee for theirs, including a deductible that's set by the government.
One of my copays was $1,065 a month for a little bottle of eye drops. And obviously I couldn't afford that. So fortunately my ophthalmologist changed it. And so now my pharmacy bill is about $90 a month between the 2 eye drops and another medication that I probably will be on the rest of my life because I had breast cancer a few years ago. So other than that, I'm in like fantastic shape.
So did you go on Medicare.gov and run your prescription list? Is that how you landed on the Humana, or was it just okay. So if you've done that kind of research, that is what we do in our office. I don't use Medicare.gov. I have private software that's a little more functional for me, but it's the same concept where you put in your specific list of drugs, the pharmacy you want to go to, and it will show you what the cheapest combination is. Sometimes it's a low-cost plan with higher copays. Sometimes it's a more expensive plan with lower copays and no deductible. It all just varies by person based on the medications that they take, and it changes every single year. No matter how much you like it, it changes.
Yeah, well, that was going to be my next question. So I am concerned about doing nothing this year. So I guess I need to start doing research between now and then because this is my major concern. My husband has leukemia, and he gets a prescription called Imbruvica, and Imbruvica was
That's
the
a
drug
pricey
that,
one. Yep.
Yes, but fortunately, we were able to get a grant
Perfect.
to help offset that, and so he has no copay right now.
Beautiful.
I don't want to do anything to rock the boat. Yeah, because that's $1,000 a day, and now they've got it down to $500
But that's coming from the
a day.
manufacturer of Imbruvica, not an insurance company.
Right, yes, and we're very thankful for Pacific Cancer Care for working with us on that. And by the way, his white blood count is absolutely perfect now. Imbruvica
Yay.
works.
Yeah.
His white blood count was like 320,000 at one time. It's not supposed to be over 9,000. So right now he's hovering around 9 or 10,000. So I don't want to do anything to rock the boat on that, trying to save the $70 that I pay per month.
Mm-hmm.
So how do I know? This is my last question. How do I know? I've been looking at the mail, but I don't know, I haven't received anything that ours is going to change. So if
you would have already received it. So those went out in September so that they hit people in early October. You got an annual notice of change that said, here's what your plan was this year, here's what it's going to look like next year. So if you haven't seen it or you threw it away with the other 10,000 piles of junk mail that you got, you do need to contact the carrier or work with whoever your agent is. You can try and call the office, but for us to pick it up in the middle, we're going to require a whole intake form so that we can run it in our system to be able to tell you what it is or where you should be.
If I call you on Monday, do you think you could? I don't know.
No, if you call on Monday, what they're going to do is send you an intake form and ask you to send that back, because we're not setting appointments for people until we have that intake form.
I totally
We
understand.
have to have the information up front. And the next appointments are already December 3rd, so hop on it now.
I heard you say that. I will. Well, thank you. Thank you. You put my mind at ease, and you have made me feel much better than Joe Namath.
Oh,
So
good, good.
you.
I'm so glad I can be better.
you
I
should
felt
do
bad when Joe Montana came on because I'm like, dude, I used to like you. Now I can't like you anymore.
Okay, here we go. Thank you,
Joe-
Linda. Nice to call you.
Okay.
Wait,
All right.
wait a minute. What is the funny sound from Steve in Pacific?
There is no more funny sound. How you doing, Mike?
Okay, there you are. Steve, you're on with Pamela.
Okay, well, I've had COVID-19, and I got over it, and I'm 67 years old. It's just like a bad flu.
Mm-hmm.
And my dad was a doctor. He didn't believe in lots of vaccines, even as a doctor. I don't myself. If you look at the animal world, very few animals are sitting there getting hauled off to hospitals.
Right.
It's because they've adjusted to the world. And I think pharmaceuticals are interfering with this adjustment process, and they're trying to make us hooked up like an umbilical cord to their corporate money-sucking machine. And we have to resist that. Now, what I want to say is this. Our physical health has a lot to do with our spiritual health. And I believe that COVID was attracted to the human race by our spiritual disease of apathy. And Mike knows I'm talking about my John Lennon rally.
I know.
October 8th. Now, people, I know a lot of you are jealous that I got this big story. I know that, okay? I know a lot of you hate me because I'm forcing you to try harder and be better people. But if we don't do this, if we don't do this and show up at downtown Monterey on December 8th from noon o'clock or whatever, 250 strong, we're going to disgrace this country historically. I've been really putting out an effort to get the people out. And right now, the government...
What day of the week is that? That's a Saturday, is it?
It's a Wednesday in about 9 or 10 days. Now, right now, the government's trying to take away my van, and they did it with another sting operation. Imagine going into a library parking lot, and the guy's parked halfway into your spot, so you got to creep up to closely to his bumper spot, and you tap his bumper. You get out, you show there's no damage, and then the guy starts to chase you with his fists. And you run into the library to call the cops, but the librarian's too busy to call the cops, and you can't call the cops because he's between you and your car. So you wait a few minutes, and he's back in his car. You get in your car, and you slowly leave, which is what I did. How about this? I get a notice in my mail 3 months later. You are being charged with a criminal offense of hit and run. And now, if I get one more point against me, they're going to take away my driver's license and ruin my life, okay? Put me on a bicycle for the next 3 years. Now, the first thing they did to me was they rolled my van down the hill with me in the back and blah, blah, blah.
We somewhere lost health insurance in this.
Steve, we love you, but you got to keep to the subject. Anyhow, thanks for calling 479-1080. Allie in question mark. Where is question mark? You're on the air, Allie. Allie.
Yes, I am the question mark.
Oh, she is the question mark.
You're calling from 805 area code. Wow.
Well, it's because of my cell phone. But I have a quick question.
Sure.
I am really old. I don't have any problems that I know of. I don't want to go to doctors.
I like you already, Allie.
So do I.
I don't take any drugs. I wish.
Bonus. That's why you're healthy. Good job.
Right. Would love something as close to possible of a catastrophic in case. Otherwise, I have Medicare and what is it?
You have a Medicare supplement?
Yes, I do. That cost me $253.
So there is a Medicare supplement, very rarely sold by agents because you can't make any money at it, but I love it. It's called High Deductible F, and it is there as a placeholder. It has a $2,400 deductible, but Medicare's paying and doing its thing. And honestly, the parts that are left over after Medicare pays are usually, for most things, pretty small. $20 here or there for an office visit, that sort of thing. And that plan is only, well, even no matter how old you are, it's under $100. It's probably in like the $70 or $80 a month range. But it's there to be a catastrophic pickup just in case you do have a really tragically bad year. My parents have that plan.
Wow.
And that was X.
It's called High Deductible F. AARP, a number of companies do not sell that plan. They only sell the more Cadillac type of plans. But I do have companies that will sell the high deductible plan. And the best time to transition to that here in California is the month of your birthday, whenever that might be. There's an open enrollment we have here we call it the birthday rule. It has a fancy name, but we call it the birthday rule. And so your Medicare supplement, if you're born in December, you have December and January to move to another Medicare supplement if it's equal or less than yours, which this would be considered a downgrade. But not all downgrades are bad. I think that plan is brilliant for people who are healthy or they're not going to do major things. You're not running to the doctor all the time. I like that plan.
I haven't been to a doctor in 35 years.
It's probably why you've lived as long as you have.
May I ask you how old you are, Allie?
87.
Good job.
Good job. Yeah, I second the emotion. Thank you for calling the Saturday special on your favorite radio station. Here's Eric in Marina. Hi, Eric in Marina.
Yes, good morning.
How are you feeling?
Well, I'm feeling just fine. The reason for my call is I was on Covered California last year, me and my wife. I'm 62, almost 63 years of age. My wife is 60. And combined, we took the silver, Blue Cross Silver PPO plan last year. And I felt very affordable at $379 a month.
Compared to what it really cost, that's pretty amazing, yes.
Yeah, right. I know they were very generous.
The real cost is over $2,000 for the two of you.
More like $3,000. Yeah.
I don't want to get on that plan.
But this year, with the same income, okay, I have a retirement plan and I have Social Security. So those two things combined, it's approximately $67,000 a year in income between those two. The reason for my call is my premium went from $374 to $1,250 for next year.
Nope, something's
Same
wrong.
plan.
Something's
Same
wrong.
plan.
So we got to look at that because that's not right.
No, it's not affordable. But
no, but that's also not right, is what I'm trying to tell you. There's an error somewhere that we have to figure out where it is and fix it because that's not the right number for two people your age with that income.
Oh.
So somewhere, Covered California, I will give them credit. They got thrown to the wolves. They had to create a system in a really short amount of time. And in the 5 years we've been forced to work with them, they've learned to spell insurance and they do things a little better. But it's a government computer system. And the code is written by people who don't understand insurance. And they get input from all these different other government agencies. And so if you miss a checkbox or you don't. It's very easy to get the wrong number, and so
because we called them after the fact, and they said, "Oh, that's the price."
Yeah, nah, I'd be hard pressed to say that that's the price. If your total household income is $67,000, here's the way you can double check it. Go to coveredca.com. So COVEREDCA, like California, coveredca.com. And then in the upper right-hand corner, there's a shop and compare tool. All you have to put into that tool is, I have a household with 2 people, $67,000, and your 2 ages. And then let it run. It'll tell you what the cost should be and end up with. And I think you will find that the Blue Shield, it's the Blue Shield PPO. The Anthem is an EPO. It's a different animal. 2 different companies. But the Blue Shield PPO is the more expensive one. And also there are some new, in parts of Monterey County, and I believe Marine is one of the zip codes, there's a new Valley Health plan and a couple of other ones that have come in that they've never had an HMO in Monterey County. This is the first time. So different restriction on doctors, but the amazing difference in the premium.
Okay, Eric. Yeah, hope that helps you. Thanks for calling 479.
Thank you for your time today.
80. Yeah. You are welcome. Pam, I finally thought of a question I've been trying to remember to ask you.
Okay.
Every once in a while, you see these. Not every once in a while, all the time.
All the time now.
You can't escape it. And this is not during the enrollment period, you know. Every other commercial anywhere has been for expensive prescription drugs. But they do say if you can't afford your medication, so-and-so, AstraZeneca, whomever, the manufacturers may be able to help.
Right.
And then you find out that you have to be commercially insured, which means not Medicare, right?
For most of those programs, yes.
Why?
But there are...
Why is that you get the manufacturer will give you a big break, and it is a big break because when I was
paid better with private insurance. And so you're not allowed to double dip and take money from the government and money from the company. There are some plans that do work with Medicare. Like we had the one caller whose husband's Medicare has leukemia, and they're on Imbruvica, which is horribly expensive, tens of thousands of dollars. And it's paid for. Whatever her Medicare plan doesn't cover, that drug plan, the manufacturer is giving it to them for free. It's part of a program that they're in. So there are programs. There's low-income subsidy programs for people whose income is under, say, $12,000 as a single person, $15,000 maybe as a couple, and don't have a lot of assets. They can get their drug plan for free, their Medicare Part B for free. So a lot of these things that you're seeing free, it's based on your income. And here in Santa Cruz County, Monterey, San Benito, there's not going to be that many people that actually qualify for a lot of those plans, or you wouldn't be able to afford to live here, right, just because of the way it is. $12,000 a year on Social Security in rural Georgia, no problem. Probably live pretty well, when your house is $100,000 for a nice house. Here, no. Your property tax will eat that.
Jeez.
So it's federal poverty level, not Santa Cruz County poverty level.
You would think, when you check into not that I've checked into all that many, but everyone I have, as soon as they hear I'm on Medicare, they say, "Oh, you don't qualify."
I do have Medicare clients who get those drugs very affordably, but it's based on their income, so you don't want to aspire to be qualified for that.
Sure, I do.
No, you don't.
Oh.
Do you really want to live on $9,000 a year, MC? No, I can see it in your face. So, I mean, it's there for the people who absolutely, it's life or death for them. There is no way they could ever afford these meds. There are programs for it. Doctors get a certain amount of prescription, there's, quote, samples. They're in the drawer at the doctor's office.
Why can't it be a free market system?
Nothing's free.
a free
There's no
market
free lunch.
system.
It is a free market system. That's why it's complicated.
It is a free market system.
Sure.
Not for
you
the-
have a choice of what you buy. You're a consumer. It's a consumable good. People hate that about insurance, that it shouldn't be, that it should be a right. In some countries, I have people who immigrate here from, Canada, European countries, whatever, and they're completely perplexed by our system because they've never had to deal with it. Insurance was something you were born with and you'll die with it, and it is what it is. And as long as you're okay with what it is, you like it. Until they tell you no for something.
Amy, you know people in your family who are from Canada.
Live in Canada.
Yeah, and they seem to like
social medicine.
They seem to like the healthcare system in Canada.
They say the quality is not that good because they had to wait so long.
Wait really long.
Yeah, because
so they'll come here when they have money to get things done.
Yeah, and then the doctor is not that incentive. Because they graduate over there coming here to get licensed, but they say they can make more money.
They make more money.
Canada is like a government worker, get salary.
Yeah, there's pros and cons to the system. I mean,
I like a system where there's only pros.
Yeah, well, when you come up with that one, I'm sure we'd all like to hear about it. But yeah, I mean, it's
Nothing
whatever you're.
perfect.
Nothing perfect. Yeah.
But nothing lasts forever.
And nothing is, I think, though, you only have a couple minutes left. The point would be open up the mail. Nothing's perfect. You have to advocate for yourself. If you don't have the tools to advocate for yourself, get somebody who knows what they're doing to help you.
It's true. And if you can't advocate for yourself, like you're in the hospital, you better have an advocate.
Mm-hmm. There are professional fiduciaries who it's their job to help manage money for. I have some elderly couples where one has Alzheimer's, the other one has health issues. And so now they've turned everything over to this person, and I actually work with that person about their health decisions versus working with them.
So who paid those?
The person, the couple, is having that set up.
Wow. We need to do a whole show on that topic only. Hey, we've come to the end of our program. I want to thank Pam Fugitt-Hetrick. I want to thank Amy Howe. And I want to thank you, the audience, for listening to the Saturday Special. See you next week.
That's all, folks.
You are listening to KSCO, Santa Cruz, Salinas, Monterey.